The case we're going to talk about today is about fungal endometritis, and this is a case from Volume 1 of the ebook Clinical Cases in Equine Reproduction, and it's case number 3. Hopefully you'll have downloaded this and read it in advance. This was a 15-year-old quarter horse mare. It presented to the clinic for breeding with cool transported semen, and the owner's goal was to have the mare carry her own pregnancy. The owner informed us that the mare has had 5 previous foals, and she was currently barren after having been bred at a different facility over 5 estrus cycles the previous year. On our initial examination of the mare, the physical exam was normal. Evaluation of her perineum, the dorsal aspect of the vulva was tilted forward with about 50% of the vulva below the pelvic brim. There was a corpus luteum visible on her left ovary, and there were multiple small to medium follicles present on both ovaries. There was no uterine edema present and no free fluid in the uterine lumen. Our overall interpretation was she was a normal diestrus mare. So we administered a dose of prostaglandins, and the type that we used was Estromate, 250 micrograms as an intramuscular injection. We ultrasounded the mare 3 days later, and we observed a small volume of slightly echogenic fluid in the uterine lumen. Based on the history of fertility issues the previous year, we had anticipated taking a culture and cytology, but also based on this ultrasound exam of echogenic fluid in the uterus that confirmed our suspicion of possible endometritis. And so we did collect a double-guarded swab sample from the uterus and a brush cytology sample. Culture of the swab, there was no microbial growth at 24, 48, or 72 hours. Cytology, there was no inflammatory cells noted, no significant background debris, which was interesting, and no microbial organisms noted. And that's different than what we had anticipated, which was the presence of a pathogenic organism on culture and inflammatory cells on cytology. Our clinical diagnosis, just based on those, was that there was no evidence of infectious endometritis on culture cytology, but we were still suspicious based on the ultrasound exam of a small volume of echogenic fluid in the uterine lumen. A decision that I regret a little bit was to proceed with a plan for breeding with cooled semen. As you'll see, we probably should have gone with some further diagnostic tests on this mare at this point. So the mare was bred with cool transported semen as the owner had requested during 3 consecutive estrus cycles. The owner had chosen a new stallion, different than the one used the previous year. The stallion had a history of good fertility. Semen quality was consistently good to very good. The mare ovulated on schedule, and there was no significant issues with mating-induced endometritis. So in other words, she cleared uterine fluid efficiently after every insemination. But after 3 cycles, we did not have a pregnancy in this mare. So we repeated the culture and cytology with a double-guarded swab and cytology brush. And this time we also added a low-volume uterine lavage, and we used the effluent fluid after centrifugation for culture, for cytology, and PCR to look for the DNA of potential bacterial or fungal organisms. Again, the culture swab, we did not have any microbial growth out to 72 hours. The brush, we did not see any significant abnormalities, but the low-volume lavage on cytology, we did see yeast organisms, and there was at least 3 to 5 organisms per high-powered field. You can see some on the right-hand side, and there's a lot more in this view than many of the views. And then we did have some yeast organisms that were engulfed in white blood cells, as we can see in the lower photograph. And on PCR, we did identify a DNA from the yeast Candida albicans. So our updated clinical diagnosis was fungal endometritis caused by the yeast organism Candida albicans. So we initiated treatment. We started with uterine lavage with sterile saline, to which we'd added vinegar to further acidify the saline. After the lavage, we infused the uterus with an antifungal agent, nystatin, and that was 5 grams and 50 mils of sterile saline, and we did that once a day for 5 days. And we also started oral administration of another antifungal agent, fluconazole. We used a 14 milligram per kilogram loading dose, and that was followed once a day at a dose of 5 milligrams per kilogram once a day again for 14 days. We did clean out the clitoral fossa and packed it with silver sulfadiazine ointment because of a possible nidus of fungal organisms in that area. We reevaluated the mare the next estrus cycle, and there was no evidence of fungal endometritis on low-volume lavage culture or cytology or PCR, but we did have a heavy growth of strep equi subspecies Zoepidemicus. And we chose on that mare on this cycle to treat her with systemic administration of trimethoprim sulfamethoxazole, 30 milligrams per kilogram orally, twice a day for 7 days. And at this point, the owner elected to stop for the season. The mare went home to be returned early the following year. And the following spring, we repeated the reproductive evaluation, a uterine swab, uterine brush for cytology, and again a low-volume lavage for both culture and cytology, as well as PCR. And all those tests were negative for both fungal and bacterial growth. We managed the mare for 1 cycle and inseminated her with cool transported semen from the same stallion it was used the previous year. And this time, ultrasound exam 14 days after ovulation revealed that the mare was pregnant on this first cycle of the year. An overview of fungal endometritis. It is an uncommon but certainly an important cause of subfertility or infertility in the mare. The incidence rate is reported to be anywhere from 1 to 5% of all cases of infectious endometritis, and it's well known that fungal endometritis can be difficult to both diagnose and to treat. A microscope photograph of Aspergillus on the right side. There are a wide variety of fungal organisms reported to be cultured from the mare's uterus, and the most common one are Candida, yeast-type fungal organisms, 58% in this study. Aspergillus accounted for 25%, Mucor around 12%, and there's a variety of other fungal organisms that are much less common but also have been reported. Diagnosis generally, in my opinion, uterine cytology is one of the best ways to diagnose fungal endometritis. Culture can. It's more challenging to culture fungal organisms. And then using molecular techniques for PCR, again, in my opinion, is going to be one of the better ways as we proceed into the future to diagnose fungal endometritis and potentially bacterial endometritis. Yeast organisms, generally oval to spherical in shape. They're about 4 microns in diameter, and most of them have a thick capsule that acts like a halo surrounding the organism, and that doesn't take up a stain. And you can clearly see in this white blood cell in the central photograph here multiple yeast organisms that have been engulfed by that white blood cell, another version of it on the lower right photograph, and some other yeast organisms that can be seen occasionally scattered around in that upper right photograph. In contrast, Aspergillus is a hyphate or mold-type fungal organism. They're cylindrical, thread-like structures. They may be several millimeters to a centimeter or so in length, and they may be branching. Cell walls are visible, and they're somewhere between 2 and 10 microns in diameter. Fungal culture samples can be collected by traditional swab or low-volume lavage. Typically, a successful fungal culture requires special media for optimal growth, like Sabrod's agar, and the incubation period may be prolonged, many days to even a couple weeks. Culture of a fungus does allow for antifungal sensitivity testing to be performed, and we know that we have false negative culture results where the culture is negative when a fungal organism is truly present. If we suspect fungal endometritis, we will send our swabs, our low-volume lavage, or culture plates to either Cornell University or the University of Texas at San Antonio for fungal susceptibility testing. In general, therapy for mares with fungal endometritis will have some type of uterine lavage or infusion to start with, sterile saline to which either vinegar has been added, povidone iodine, or potentially hydrogen peroxide, intrauterine infusion of an antifungal agent, systemic administration of an antifungal agent can also be important, and then it's recommended to cleanse out the clitoral fossa and sinuses for potential nidus of infection in those areas. Over the last few years, we've chosen, when appropriate, to use a combination of nystatin as an intrauterine agent and systemically to administer fluconazole, and typically we'll put a Caslic in these mares. Not all fungal organisms are susceptible to nystatin. In the same way, not all fungal organisms are susceptible to fluconazole. Hence the suggestion that antifungal susceptibility testing be performed. That would allow you to choose the most appropriate antifungal agent or agents. There's a number of possibilities, and several formularies have suggested the following: either amphotericin, clotrimazole, fluconazole, miconazole, or nystatin as intrauterine antifungal agents. Lufenuron has been suggested, and then orally administer either itraconazole or fluconazole. In bold are the two that we recommend most of the time, but again, importantly, it's after antifungal susceptibility testing to confirm that those are indeed appropriate. The take-home message for this clinical case and other cases of fungal endometritis is that fungal infections are difficult to diagnose. Low-volume lavage is now our go-to for it, and PCR is helpful as well. They're challenging to treat, and our suggestion is to be assertive or aggressive with treatment. Our recurrence rate is high, and that's often due to incomplete elimination of the organisms in the first round of therapy. You should always reculture the uterus to confirm that the fungal infection has resolved. And in many cases, we've noted that we may be able to eliminate the fungal organisms and subsequently culture a bacterial organism such as Strep equi subspecies Zooepidemicus. So be prepared for that. For additional information on clinical cases like this one or other cases, you can refer to the Equine Reproduction Laboratory at Colorado State University, visiting the website, Facebook, or Instagram. Thank you.